So we are here with Langdon Roberts at the Santa Cruz Neurofeedback Center, and there will be a brain health talk coming up soon. Is that correct?
That's right, April 22nd.
And can you tell us a little bit about that?
Sure. We're going to be presenting an overview of how we can maintain a healthy brain throughout our entire lifetime. So we're going to be addressing the nutritional, behavioral, emotional, and cognitive practices that are going to support a healthy brain and a healthy life.
Fantastic. And where will the talk be being held?
Lauden Nelson Center, Auditorium.
Fantastic. And this is at no cost to the general public,
That's
correct?
right. This is a free presentation.
So Langdon, you are with the Santa Cruz Neurofeedback Center, but this is a collaborative effort from 4 practitioners around the area. Is that correct?
Yes, that's correct.
Fantastic. Can you just give us a little background on yourself and the others?
Sure. So I'm a neuroscientist, a neurophysiologist by training, as well as a massage therapist. I actually trained in massage therapy before I became a neuroscientist. And so my approach is both, from the holistic background and the traditional Western science background. The other practitioners that will be presenting are so Aida Hasbun. She's an MD, an integrative medicine specialist, and she'll be speaking on the nutritional aspects of a healthy brain and what type of nutritional supplementation and support would be optimum for a particular individual. Then we have Jennifer Bahr, who is a naturopathic doctor, and she will be speaking on the use of homeopathic remedies to replace or supplement some of the traditional medications that can actually interfere with efficient brain function. And then we have Jennifer Alexander, who is a marriage and family therapist, who will be speaking about the psychological elements of brain health, specifically on resolving traumas that may be interfering with a healthy brain function.
This event is being sponsored and promoted by the Santa Cruz Neurofeedback Center. So would you be willing to just give us a little information on exactly what neurofeedback is?
Sure. Neurofeedback is a process of measuring the brain's activity using an EEG or sometimes other types of technology to determine the patterns of activity in the brain, and then using that information to optimize the brain's function. So, for example, we might take a brainwave pattern and decompose it mathematically into different brainwave frequencies. These are the alpha, beta, delta, theta waves that many people have heard about, but most people don't really know what they are. And then we can learn how to shift the balance of these different brainwaves based on the task at hand. So for example, for a high level of attention and cognitive processing, we usually want a lot of very slow beta wave activity, the lower end of the beta scale, which is in the range of maybe 12 to 20 cycles per second, as opposed to, say, a lot of theta activity, which might be more useful if you are in a deep meditative trance. So we tune the brain's activity to the task at hand.
Perfect. And this is an educational program, is that correct?
Yes, that's right. So this is not something that we actually do to your brain. You actually get the feedback, which is why it's neurofeedback. You get the feedback from your own brain, and you use that as information to fine-tune your own brain's activity.
What is neurofeedback used for?
A wide variety of applications, really. We do a lot of training of people who have anxiety or depression or learning difficulties, so that people are able to shift the way their brain functions without having to resort to medication. We do work with a lot of people who are on medication, and the neurofeedback actually enhances a lot of the functions of the medication, but we also have a lot of people who either do not want to be on the meds at all or want to taper off of the meds, and so then we work with the doctors to try to replace the medication approach with a brain training approach whenever that's possible. Neurofeedback is also used for peak performance training. Athletes, executives, students, anybody who wants their brain to function at the highest level possible can use neurofeedback to really optimize the brain function.
Great. So are there more likely clients, or is it really for everyone?
Well, it can be used by anyone. The people who are most likely to show up are people who have a diagnosis of attention deficit hyperactivity disorder or anxiety. But a diagnosis is certainly not necessary. In fact, we don't really work on the whole model of diagnosis and treatment. We don't think of this as we're fixing you. We're just trying to help you to achieve the best function you possibly can have. So whether you have a diagnosis or not, you can improve your attention, you can improve your capacity to manage your stress, you can manage your mood, create more stability, create more motivation. Motivation is a very big factor in success and happiness, and a lot of people need more motivation.
Great. And are there other services that are offered alongside the neurofeedback, or is it your primary focus?
We do offer a wide variety of supportive services. We have psychotherapists here at the center. We do massage therapy. We actually do a special type of massage called neuromassage, which combines massage and biofeedback and neurofeedback to deal with chronic pain and chronic anxiety issues. We have other types of biofeedback where people learn to manage their autonomic nervous system, things like the heart rate patterns, or the flow of blood into the extremities, which is associated with a sense of calm happiness or a positive mood. Working with the sweat activity, which is also called the galvanic skin response. That's a classic form of biofeedback used to manage anxiety. So yes, we do a wide variety of practices here in addition to the neurofeedback.
And again, that's the Brain Health Talk, and it will be hosted on April 22nd at the Lauden Nelson Center Auditorium. Thank you so much.
You're very welcome.